So today we're going to be talking about map teams. And I think I know everybody, but I'm Joy Hogge. I'm the Executive Director of Families as Allies. And I'm only going to be on here for a few minutes, just in case that makes everybody happy. I have a board meeting that's been scheduled for a long time with the group I'm on. Um, a, a board committee meeting that I have to get on. So Nikki's going to facilitate this, and we want everyone to jump in. And as y'all know, we have been looking at families as allies for a long time, like how can we support MAP teams in the state? How can we strengthen them? How can we help them function? Um, in ways not to criticize any MAP team, but to give them the support they need to help families be part of them and to help them function the way they were meant to function and do the things they were meant to do. Now, in doing that, one thing we've learned is sometimes there's all these different impressions of what MAP teams do, and people may not even know what their purpose is. So this is a session where we'll be talking about that and kind of getting back to basics and then looking at how can we all work together to make MAP teams function in more strongly than they are now, and to give them the support they need. What do they need to be able to do that? And we're looking at that both as we want to help, but also we work on policy. So are there policies that aren't working that well? What needs to happen? Or maybe everything's going really well. We don't need to do anything. So that's where we are today. And Nikki's going to help facilitate this discussion. But this is really about everybody talking together. And I think she's going to start with a PowerPoint we do just to refresh everybody on what the state law says about MAP teams. And I'm going to jump off here in a minute. But y'all from Families as Allies, tell me, is that kind of what we said we do? And does anybody have any questions for me before I get off? And I know I need to make you the host, Nikki.
No, but I know Nikki's going to cover this. So this is the training that come from parent caregiver peer support training, the presentation.
Yeah, we use this presentation in parent peer support, but this is whenever we try to be extremely consistent. So whenever we talk about MAP teams, this is the PowerPoint that we use. Like there might be some slides that come in or come out, but I think even like when I presented it to the ICKY, that was the one we used. So yeah. So some of you who have been through parent peer support training, you might think I've seen this before because you have. And I'm going to put them again because, the new people don't see them. I'm going to put what we said we do today. Okay. Any other thoughts, comments? And this really is about sharing. So we just want to know what everybody thinks. It's not like it's going to be, you're not going to get a test at the end. Oh, one other thing, we are recording this. And typically what we do is share this out for people who couldn't be here, like in a blog. So sometimes somebody ends up talking about their child or something like that. If anything like that happens, we'll take that out, or you can let us know if you don't want us to share this. But if anybody has any issues with us sharing this, you can send me a message in the next little bit or send a message to Nikki or anyone from Families as Allies. And we won't share it, but that's typically what we do. And it'll probably start sharing at the beginning of the presentation. Okay. Anything for me before I go to my other meeting? I'm very grateful to all y'all for being here. Let me just make sure we let everybody in, didn't leave anybody stranded in the waiting room. Okay. I'm going to make you the host, Nikki. Okay. And I got to say, go forth and conquer, because that's how we end all our meetings. And I'm ending this one for me right now. So it's good to see everyone. Y'all go forth and conquer and have a wonderful discussion and brainstorming and just see what you come up with. Thanks, you guys.
All right, guys. My name is Nikki Flippins. I do work here with Families as Allies. Is everyone able to hear me? Okay.
Yeah.
Okay. Just wanted to clarify. So, as Joyce said, I do a lot of the training when we do the parent caregiver peer support, and this is one of the modules that we normally cover. Joy did mention that the parent caregiver peer support training that we have is composed of various modules on different topics, all of which are designed to be presented to people who are doing the training, but they're also designed to be standalone modules, which means if somebody just only wants something on a particular topic, we can pull it out. So that's what she meant when she said we do use this for other reasons. So if someone just wanted some information on map teams, this is likely the module that we would use. So I'm just going to highlight a couple of things related. This is the way it's titled when we do it in the actual training. But of course, our goals in doing it is to always make sure people know who we are. You know, us at Families as Allies, we are the only statewide organization run by and for families of children with behavioral health challenges. We support each other and work together to make things better for our children. It lists our vision, which is that all children have an opportunity to reach their potential and succeed. And our mission is that families are partners in their children's care. Our core values are every child and family, excellence, partnership, and accountability. We also have all of the ways in which people can connect with us, which is through our webpage, phone number, Facebook page, and email address. These are our beliefs from Families as Allies, is that families know their children better than anyone, that families are their child's strongest advocate, and that systems should follow laws and policies about families and children's rights. Our objectives for this model, for this particular module, when we do it, is to first talk a little bit about the system of care, because we want to make sure individuals that are doing the parent caregiver peer support truly understand what we're referencing when we talk about the system. So we do cover those things, the framework of the system, as well as what family-driven practice means and the guiding principles of that. We can look back at those if anyone happens to want to know more a little bit about that. But our primary goal in looking at this particular module is to talk more about policies related to the MAP team. So, but in doing so, we do talk about the system, since that the MAP teams do fall under the Interagency Coordinating Council, which oversees the actual system. The law does tell us that the system shall be family driven, which means that people who are coming to even the MAP teams from all of these different systems, that the idea is that they would be coming in representative of the idea of being family driven. So when we get over to what does the law say about MAP teams? It does tell us that the local interagency coordinating care council MAP teams will facilitate the development of the individualized system of care programs for the population targeted in section 43-14-1. Each local MAP team or A team shall serve as the single port of entry and re-entry to ensure that comprehensive diagnosis and assessment occur, and shall coordinate needed services through the local MAP team, and A team members shall local service providers for the children named in that section. Now, when we do this in training, of course, that's a mouthful. And so what we do is take a step back and talk through, what do we really mean by this? The law says that the MAP teams are designed to basically be a one-stop shop. So when we look at it being the single point of entry, what it's telling us is that the MAP team serves that targeted population of children and youth up to 21 years of age with serious emotional behavior disorders or serious mental illness, who are at risk for an inappropriate 24-hour institutional placement due to the lack of access to or availability of needed services and supports in the home and the community, or they are returning to a primary caregiver in the community from an inpatient acute psychiatric hospital or psychiatric residential treatment facility. Again, that's a lot of words. And to go back and break those down, what it's telling us is that the MAP team is in place to ensure that families in their area, the area in which they serve and support families, are able to come to the MAP team if they have a child who's struggling in areas that could put them potentially in a position that they may have to be placed outside of their home. So if there's a child who is acting out at school, they may be getting some mental health services already, or they may not. They may be having issues in the community, at home, with a parent, with grandparents. And because of those struggles, this parent finds themselves in a position where they may need to consider this child needed to be placed either in an acute setting, so a short-term hospitalization, or a residential placement, a longer-term setting. The goal is that this family could instead come before the MAP team and present the kind of concerns that they're currently having in their home. And if this MAP team has been created truly to be a one-stop shop, meaning that they have representatives from each agency in their community that falls under those different systems, they can then offer that family what supports and services they have that could potentially reduce the likelihood that this child would have to be placed out of their home. We do know that even though this is in place, kids do oftentimes still end up in acute long-term settings. So it could be that maybe the services weren't put in place in time, or the family didn't know that the MAP team was there and this is an option they could have used. So this family already has a child that's in an acute setting, or they're already in a long-term residential setting. That doesn't mean that the MAP team isn't still a viable option for it, and the most logical option, because remember what we said, that the MAP team is not only there to provide those supports and services pre a child going to placement in order to prevent that, but if that child should happen to need to go or already be in placement, as that child transitions back home, or prior to the child transitioning back home, this would be an ideal place for this family to come to present and say, I have a child, 10 years old, female, who is having these particular issues and needed to go into an acute setting, a long-term setting. They have a discharge date of June 10th. These were the issues that were present prior to going into treatment. These are some of the issues that are still present and the type of supports that I'm going to need, so that that family can then still go to their MAP team, hoping that it's going to look like that one-stop shop, to be able to say, these are the things I'm going to need in place when my child transitions, to make it more likely that we would not need this type of out-of-home placement again. And so those services can be explored and secured even before that child gets back home. So those are the major things that we want to make sure people are really clear about when we do this particular presentation. And it does come up periodically in some of the other modules throughout the training week when we do training with parent caregiver peer supporters. And if any of them are on here, they know that we go over this many, many times, but this is the standalone module that we share with them. What we talk to them about when we say a one-stop shop is that this is our system. The families that they're going to support are there in the middle. All of the systems that surround the child and family are those systems that are available to families in the state: mental health, social services, education, health, substance use, vocational services, recreational services, and operational services. And I did note on this particular visual, which we have another one farther down, this particular one doesn't have juvenile justice, but that is a system that's available for families in the state. Not every family is going to access every single one of these across their child's lifespan. Even the ones that do, they may not access them all at the same time. But the goal is that when you look at the system in your area under mental health, what agencies are available in that particular area? And those particular agencies, both public and private, it would be very beneficial that a representative would be there and present for each map team, but that's why they're going to look different in different areas. If you live in a larger area of the state where there are more options, then that doesn't mean that we want to limit and say, oh, well, we have the mental health center and we have one private agency. We want to have people who are representative of that particular system. So under mental health, we want to have options that cover that particular area. So one area may only have 3 options, one area may have 10. Even when you look at social services, we may say, well, we have a representative from Child Protective Services, but we do remember that people in Child Protective Services do have various roles as well. So if you have a smaller county where one person does multiple things, they may be sufficient in being that representative. But if you live in a larger area where they're more specialized, you may need a foster care worker and someone who does licensing and someone that does another piece in order to ensure that you have a representative there who can offer the type of insight that would create that one-stop shop. Same thing for education. You know, someone who's in lower education may not have the same knowledge as someone who services in high school, as well as a social worker or a counselor. So we want to look at each individual system in those areas and talk about who do we need in our community to be at our table, to be at this table for these families, to offer a wide variety and create that one-stop shop so that the families get access to all different types of support services and resources in order to either prevent the child from having to be placed out of the home or to assist the family in having what they need when the child transitions back home. Anybody at Families as Allies want to jump in and add anything to the information that I shared so far? So what I want to do is take a moment because I have given the information that tells us about what the law says and why the MAP teams are there and functioning. We do know that there are some other options that are available that we do share with families as well, and I'll go over and look at those for just a second. So there are some other issues that MAP teams can help with. And then we also make sure that people who participate or attend any of these trainings understand that we can start with children who may be very young, because we did say 3 to 21, but also MAP teams do have some flexible funding that they can use for some general reasons. And, you know, anytime a family has some very specific needs, those can be included in asking for those other types of supports to, again, prevent the child from being placed out of the home or assisting a child that's transitioning back. However, we also want to make sure that their basic needs are met, because it's kind of hard to focus sometimes when you have a family who's worried about their child being placed out of the home, but they don't know if they're going to have any lights next week. So some of those resources may be addressed by flexible funds through MAP team. But remember too, if we actually do our due diligence and we create those teams to the extent that we hope that they're going to look like, there may be also other community options at the table who can say, hey, there's a food issue. My church has a food bank. So my church does funding for other things as far as helping with utilities. So creating that one-stop shop doesn't just also offer that opportunity for other resources, but also for the child, but also for the whole family, if there are other things that those other entities offer as well. So that's one of the reasons why we really want to make sure that that's happening. Now, what I want to do is look at our objectives. And one of the things we talked about is that after this presentation, that you would be able to describe the purpose of the MAP team as described in state law. What I want to get is feedback from other people about differences that they have experienced or that they understood about what the MAP team was really designed to be. And just because you've understood it to be something different, or it's been presented as something different, it doesn't make you wrong or them wrong. We're just trying to clarify based on the way it was created, if people are getting the same information, if they feel like their MAP teams are operating from the standpoint of what the law states and how it was created to function. So I don't want people to feel hesitant about sharing, but just wanting to get some feedback about how people are seeing this. Surely somebody has some feedback to give me. Well, let's start from this standpoint. Do we have people on today who are members of their local MAP team?
I know we have one. She's somewhere on here. Where you at, Rena?
Yeah, Karina's down there. Yeah, she goes to
Yeah.
quite a few.
I'm here, Shane.
Okay, so Karina's on here. Anyone else who is a part, even if you're not a permanent member, anyone else who has had the opportunity to visit a local MAP team. I'm not going to ask you about any of your personal experience because we're not asking people to share their personal stories, but just able to share anything pertaining to just witnessing what you've seen or experienced as a part of a MAP team. Okay, someone did mention that they're not familiar with their local MAP team.
I've joined Region 6's MAP team meetings, and they're really good. They bring in people from all over the Delta, and they review cases, and they see who can help when and how and where, and it's always acted as it was supposed to.
Well, that's good to hear. That's great. I appreciate you, Miss Victoria, for sharing that with us.
No problem.
And also, are there other people who are not familiar with their local MAP team and unsure of who that facilitating agency is in your area?
Nikki,
Okay.
I'm trying to pull up the DMH directory so that if you want, I can project that at a later time so that everybody can sort of scribble down their region and their area and their MAP team coordinator.
That'd be great. I appreciate that. Definitely, because that's what I was going to ask if somebody else could do that for me, either Jackie or Karina. But if you got it, hey, we're okay with whoever has it accessible that can share it. But one of the things that we do want everyone to know who, how it works is that there are MAP teams across the whole state associated with each county. Sometimes in some of the smaller counties, they're the same agency that service multiple counties may be they may be the one that's facilitating the meetings. So sometimes they may be held together. So it depends on what part of the state you're in. But each of those agencies that are the designated person to facilitate the meetings, it's just important for us to always remember as well is that the MAP teams are the community MAP teams. There are people, for example, even in the Hinds County area, Families and Allies is a designated agency, and Henry Moore, who spoke a moment ago, my coworker, facilitates those MAP teams. It doesn't mean that the MAP team belongs to Families and Allies because this is a systems approach. Remember, this is in order for everyone in that particular community to come together to be a part of that. But someone has to be a designated body to work on bringing those individuals together, making more people aware, and to help to the best of their ability, along with the other people on that MAP team in the community, to ensure that we have some good representation from all those different systems. So reminding us, like I said, that these are not, that it doesn't belong to that agency, but they're the one that's facilitating those monthly meetings. I think someone asked about how often do they meet. They do meet monthly. However, sometimes families do have referrals that come in between the times of the meetings, and there is a process that a referral can be reviewed at a time where, because if a family's in an emergency and this is going to prevent possibly a child from having to be placed out of the home in a week, we may not be able to wait if the MAP team meeting was yesterday, another month to say that we're going to then come together. If you're, I think Shane said he was going to share the information, Ms. Davis, about how you can locate the information for the MAP team in your area, and the schedule varies. So it would be best to be in contact with the MAP team coordinating agency and the coordinator within it in your area to be certain about what their schedule looks like, because I definitely don't want to give you any inaccurate information. Some may meet in the morning, some meet in the afternoon. Some have a designated space that they always meet. Some kind of move around to different agencies, because remember, we're talking about different agencies being a part of this particular team. So we want to make sure that that's representative as well. Most of those MAP teams do offer an in-person, and many, I think, still offer some virtual attendance as well. But again, that would be more specific to each particular MAP team. So I would definitely check with them.
And I think that's part of why sometimes we don't get as much involvement, because the schedule is not a standard schedule. It's more fluid. And I know I govern the Children and Youth with Special Healthcare Needs program at the state level. And it's very rarely that because the schedule is very fluid. So it's hard to be consistent in it and to offer supports as much as programs would like, at least for my program. So
in most of the areas that I'm familiar with, and I can't speak, like I said, for everyone. I do know that they're not standard across the state. It's not like, every MAP team meets on the third Wednesday at noon. But in most of the ones that I have tended to be a part of, that particular MAP team has some consistency to it. Like they consistently, what's your schedule, Henry, consistently for the MAP team?
Every third Wednesday, 1:30, and we rotate from our different MAP team participants. Okay, so and Felicia, I don't mean to speak up for you. She's with the Department of Health, and I know schedules vary, but like state entities like the Department of Health, CPS, usually have representatives on the MAP team. So although there are different times, but I'm pretty sure that a representative from Mississippi State Department of Health could have a representative. And I know with our MAP team, we have state entities on the MAP team. So if that helped, Felicia, hey, how are you doing? Good to see you.
I'm good. Good to see you as well. Yeah, I'm sure. I don't know who our representative is. That's probably the issue. And since I'm in the area that deals with the children and youth services, it kind of makes it crazy that I'm not aware of when our team meets consistently. So I think Nikki did a great job of explaining the purpose and being multidisciplinary and supporting. It's difficult sometimes when we don't know when, or even, how agencies are. Sometimes they'll just send people and that information doesn't get filtered down. And I just want to make sure, it would get to somebody who can offer some sort of input or saying this is a resource that's available for it to be most effective. Because I think it's time out for just people having representatives if we truly want to impact change. So that was my question, and how we could better support and make it much more effective.
Right.
Right.
Felicia, I'm glad you brought that point up because the last two map teams, we discussed that topic. Actually, there are people that are on map teams from, because if you are DMH certified, let me just say, it's a must that you're on the map team if you're a DMH certified agency. But what we found within our map team in Hinds County, and we have a pretty large map team, there are probably about 20 entities on our map team. What we found is that some of the agencies or providers, they put people on the map team, but the people that are on the map team are not coming in contact with those youth that are leaving, going to PRTFs or acute care, or are returning. So that's something, as far as my outreach, what I've been doing for the past 3 months is like, are these people on the map team making this map team, I think, Felicia, you said, effective, right? And I don't think, and I'm just speaking from Hinds County, I think that the providers should put people that are coming in contact, just like the person that's doing admissions or discharges, that therapist on the MAP team, because they're seeing the kids that are going to acute care, that are going to PRTFs, that are going to a youth court, into that system. They're seeing it, but they're not necessarily on the MAP teams. They're putting people on the MAP teams that are just on some of the MAP teams. I'm just being honest about that. So thanks for that, Felicia.
Thank you, Henry. I appreciate that because I know my program does birth to 21 children with special healthcare needs. And I'm also an endorsed reflective supervisor for mental health. So, and having been in mental health for a lot of years, I understand the impact, but I'm not on the MAP teams. That's why I didn't even know when they met. I knew they met and I knew the purpose, but it's been 20 years since I'd been on a MAP team. So that's why I don't know who our agency representative is. No clue. So I just throwing it out there. I don't know if this is anybody else's experience, but it's mine. So
We do hear that a good bit, and I'm glad that you said that about, because it brings up what the second objective was, which is what is my role when I'm there. And so that's important for people to know, because like you said, a lot of times people have gone to meetings and they show up because somebody told them to go. But they either don't have the actual knowledge of what Henry said, which is which of these children are in your particular agency that could be at risk, that we may be able to put something in place to prevent them from having to go out of home, or these children may be transitioning. Just recently, when we did our last parent caregiver peer support, we had an individual there who was doing parent caregiver peer support at one of the residential treatment facilities in the state. And I thought that was really valuable because now she recognizes that the significance of the MAP team. And one of the things she talked about is work. We made sure she had that list as well to know how to contact, because she's going to need the whole state. She doesn't just need the one in her area, because they have children that are placed there throughout the entire state. So she knows how to go there, locate which MAP team would be connected to the child that's there at the residential facility, and work with the family to get them connected to the MAP team prior to this child transitioning back, so that they can have that support as soon as their feet hit the ground. So that's what we want to see. That's when Henry mentioned that it would be the people that we need are the people who are either the gatekeepers for kids going out, or the people who are watching kids come back in, because this is how we want to see this operating. No one said it, and that's okay, but more often than not, I hear when I do this particular presentation for individuals who are going to be doing parent caregiver peer support and have any knowledge about MAP teams, that their idea of the MAP team was just you would go there if you needed a bill paid. Now, we did talk about those flexible funds and the idea that there are other resources that can come up that can be helpful in those ways, but that is not the primary reason why the MAP team was created. And the idea that that is the only function that many people think that they operate from puts us at a disadvantage, and it does increase the likelihood that people aren't going to come because they feel like this could be an opportunity to get their child all of the resources they need in order to prevent them from going out of the home. So now that I've said it, I don't know if other people will expound on the fact that that's kind of what they hear at times, or or what they see oftentimes when people are operating from the perspective of, hey, let's do a referral to the MAP team.
I'm glad you did mention that, Ms. Flippins, because I know a lot of people when my care coordinators come to me and they're looking for resources, and families mention that instead of them truly seeking what families need, they're thinking, let me just plug this immediate hole, not realizing that's a bigger component to that. And so they don't even get the full benefit of the resource and support they need, because the money was not just the resource that they needed. It was something that continues to cause this issue because they continue to have these monetary concerns. So
Exactly.
I think that's where working with other support organizations, and like what you've done here, I'm going to reach out to y'all so y'all can train some of my care staff. So when they're working with families, they have a bigger understanding. So I'm not just going to refer somebody to the MAP team because they need some money to pay a bill, you know, because
Right,
sometimes
right.
that's often what they'll look at. So I think
Exactly.
that's an excellent point. Thank you for bringing it out.
And one of the examples that I give people in talking about the money part of it is that we do recognize that families do run into binds. For example, if I have a child who's acting out at school and I'm constantly getting a call from the school, and maybe 2 months ago, I ended up losing my job because, you know, my child is definitely in a position where they may need an out-of-home placement because they're acting out at home, they're acting out at school. I can't keep a job. So maybe I miss a month of work. And I've now at this point secured a new job, but as an hourly worker, not making a great deal of money, I'm still behind and I'm dragging in the hole because there's a gap between those 4 weeks. So now I have my child still connected to services. I still need some supports because the school is still calling. I'm still trying to maintain this new job, but I need some way to ensure that my child is still going to have lights in the home while I do this. So yeah, we need an immediate address to the fact that they need lights in the home, but we haven't addressed the root cause of what led to this. Because if we don't, then I may lose my job again in a month and I'm still back in the same position. And the MAP teams, of course, even with the flexible funds, aren't designed to pay bills over and over and over and over again, because we're looking for a long-term solution. So that's one of the things that I do share with the parent caregiver peer supporters as well, to make sure that they understand we're not downplaying the fact that there's flexible funds, because we do know. And we also remind them that it doesn't always have to be about a bill, that, you know, we've seen MAP teams do some very unique things for children who may need other opportunities to get involved in certain things where the families don't have the money. Again, that could be that the MAP teams uses those funds in that way, if it's allowed, because I'm not going to overspeak myself because I don't know all of the details about how the money is approved. But if we have a true one-stop shop of people in our community, sometimes there are other people there at the table. Because remember, we want to include that places like churches in our community. Sometimes they're able to provide some support for like recreation, tutoring, like I mentioned earlier, food. So if we create that and stay diligent about having those people as a part of that team, hopefully we're going to be able to meet those other needs along with helping these children remain at home or helping them transition back home.
Can I add something, Nikki?
Yeah, for sure.
Shane, fellow MAP coordinator Shane up in North Mississippi, is that, and I know Shane does that, and we've been through trainings together, and we've done trainings together, is having those resources on the MAP team. Okay, so it doesn't have to be that place where you go get bills paid, but there may be someone on the MAP team that maybe is part of a church or someone that has those resources. And a lot of our job, I know Shane is as well, is trying to put those resources on the MAP team, because we have very limited funding to use, for families. But having those people on the MAP team, and then having people like in Hinds County, most of our MAP teams are they're mostly social workers on our MAP team. So, and social workers, Nikki is one. They have all the numbers in their phone for every type of resource you need. And as soon as a family says the resource, they're directing the family to the resource. So Shane, maybe you can talk about having those people on the MAP team. Just say if the MAP team itself don't have the funds, but maybe there's someone else on the MAP team that has those resources for families.
Yes. So, I mean, I know for us specifically, we try to have people who have been part of social service systems for years. And I know we have a couple of ladies, especially that they're near retirement, but anytime we need something, they pull out, like just this morning, we have one. Let me text my lawyer friend and see what this person's rights may be in terms of eviction and stuff like that. And so, even on our meetings, we'll get on the phone, we'll make phone calls, and we'll stay in connection with the parents. So we try to reach out in the county, especially, and this is sometimes where it may be difficult in the rural regions, but in larger cities like Tupelo that I serve, we try to find those resources for people who, well, hey, I know somebody, or I have a friend who does this, who might can step in and fill that need from the community itself, who may not even be a part of an organization. And that's really where we like to focus, is what needs can we find that may not be as well known in the community, or how can we find that one person who knows the answer to a question that none of us may have seen before. And so we just try to keep that well-rounded and all that good stuff.
And herein, Shane, I think points to make. I also think it's important that people know how to help families leverage the systems they already have. Because sometimes, because of what's going on, and I'm going to use Nikki's example of the parent who keeps getting called to the school for all of these issues. If this child doesn't have a special education eligibility ruling, then that child probably needs one. And if they do have one, then the school can't just automatically expel, or if they're calling the parent to pick them up, they have to reimburse them for mileage and all of these things that families aren't aware of, that they are entitled to supports already built within a system. Because sometimes you don't necessarily have to go out and ask for these things. And what I can tell you, schools don't like to give up this money, so they'll start implementing things in the school so the mama not having to keep coming back to the school. And I spent 20 years in SPED at the state level, so I always tell people when I left I was going to be an advocate for family. And so what I tell people when I'm training them is, people do what they think you don't know that they can't do until you show them that you can. And so once families start pushing back or demanding their rights, which they're already entitled to, the schools suddenly get all of these different things that they can do with the child that they should have been doing all along to keep the child in the school. And that way that parent can keep that job, because all entities don't have unlimited resources to always help pay a bill and all of this. And sometimes you see the same families with the same concerns routinely. So how do we help families leverage resources they already have? So it's not just about having those lists, although they're good and I can call somebody, but how do I empower those families to utilize those resources they already have? And that's something that I think we have to do more of with our families, because what I've experienced is sometimes we create learned helplessness that they know they always can reach out to somebody and we can get some kind of resource. And our goal is to help them so then they can come and help somebody else. It's each one teach one. So I think we're doing great jobs, and we just got to get more of us out there.
Yeah, that's a good point, Felicia, because you talked about something also we call the MAP teams making a plan team. So we actually make plans with the families, okay? Just say, if we assisted you with this, what's the plan? And as coordinators, Shane and I, we follow back up with those families. So yeah, that's good to know. That's what we do. We make plans with them. We don't just do one thing and kick them to the curb, but we know this got, we find out, how did this happen? And let's make a plan. So yeah, that's a good point. Good points, Felicia.
Definitely. And when you mentioned it about this, remember I said before, when we do our complete training with the parent caregiver peer support, we do include various systems. We not only talk about the MAP team, but each of those systems that we looked at earlier, we go back and talk about how to help families, support families in each of those different systems, in the health system, in the mental health, in the school system, in juvenile justice, in social services. So we have an end of, and when we focus on the one on education, we do talk a lot about advocating with families, and we do that in each of those systems to ensure that people understand that our goal is to help families recognize the power that they do have within that's already built in those systems. So we do want to support them in transferring that knowledge that the families are already their child's strongest advocate, because who tends to gain the most from their child being successful? That particular family. And if the child isn't being successful, that's going to fall back on that family. So we want to make sure that the individuals that are going to be supporting the families understand how to advocate with them, so that when there's no professional there, when there is no one that they consider a quote unquote advocate, that they understand how to go about addressing getting their needs met and their children's needs met. I think a few people may have joined a little bit late, and so I don't know if somebody can drop the list in again to make sure that individuals are able to access that list and know who their MAP team coordinators are. Thank you, Jackie. Additionally, Karina did add in, and that's the one thing we do need to make sure as well, is that MAP teams are required to also have family members on that MAP team, because we want to make sure that people who could potentially or may have previously been in a position to access supports and services through the MAP team are there, because we want to hear their voice and get their insight on how certain things are happening within that MAP team and how we're supporting those families. Sometimes as professionals, we see things one way, but as a family on the opposite side of that table, it may come across very differently. And having someone as a part of our team who understands that can be invaluable. So we do not want to forget that piece, that there also needs to be family members that are there.
Oh, Nikki,
So
Nikki,
go ahead.
I'm sorry.
Go ahead.
I'm sorry.
Go ahead.
I just missed the message. It was from someone that was on, and they had spoken with Linda Stewart in Department of Mental Health, and she said for them, and I think it's our MAP team here in Hinds County, and she said they need a representative, and that's another thing. She's absolutely right. Okay, and I say this to the MAP team members: if you are a certified Department of Mental Health agency, okay, if Department of Mental Health certifies you, then it's not you just get somebody on the MAP team. That's part of being certified as a DMH provider. So the person in the box said that Linda had said to get with us, because that's part of your certification. So like on each MAP team for the county, it should be, if you're a certified Department of Mental Health provider, you must be on the MAP team. I was just answering the question. I think the person already left, but I just saw that in a chat just to me.
And remember, when you talk about putting somebody in that role, consider who you're going to send, because one of our objectives was to understand our role, and our role is there to actually be able to provide some insight and some resources. But if you aren't that person who can do that, then that's not likely the person that needs to be the representative for that agency, because then that doesn't actually give us all of the tools and people that we need to clearly have that one-stop shop for those families.
And I know Victoria's on here as well. Victoria, maybe that is something that coming from DMH that you can help us with. Victoria is she's the statewide person. Let me just be plain. She's over all the MAP teams in Mississippi. And Victoria, is that something that you can help with, like letting people know that when you put these people on the MAP team, it should be someone that's coming in contact with these kids, or is something that we can work with you on that, Victoria?
I think generally the way it's written in the RFP is that each agency has their own leeway in how they initiate the child getting involved in the MAP teams. So like you said at the very beginning, you know, it should be those therapists and those case managers and all of those people connecting them. But then when it comes to community partners, we have a resource that lists I think Shane said he was going to bring it up with all the coordinators' names. And then as far as the private DMH providers who may not facilitate a MAP team, when they go through the certification process, they're being told that they have to join a MAP team if they don't already have one. So it's being put out there, but I don't know how we can emphasize it more.
Corey, is
Thanks,
there a way to access a list of these private DMH certified facilities that aren't community mental health centers, so that maybe us as MAP team coordinators can reach out to them and facilitate that?
I could send you, let me pull it up. Hold on one second.
And while you're doing that, is there anyone else in any other role, including individuals who may be on here from DMH, who want to offer any other comments, advice, suggestions, even corrections if you feel like for some reason that what we're sharing is not accurate? Because we want to make sure, you know, from all extensive purposes that right now, based on, you know, the information we have, this is the information that we share with individuals that ask us about MAP teams. But we do want to also open the floor up to anyone else who has anything else to share or suggestions.
Nikki, this is Karina. I know I attend MAP team meetings across the state, and each MAP team I see is having the same issue about getting MAP team members on the MAP team. And I always, you know, ask the question, if you have MAP team members that used to attend and don't attend anymore, reach out to those MAP team members, you know, and invite them back. Because sometimes, yeah, our schedules are very, very busy, but this is an entity that we need all the community partners, all the resources that we can to come to the table, because the more resources that we have, then you won't feel like that you have to do it all by yourself. The more resources at the table, the more we can support families, like, you know, in a family driven way.
Thank you, Karina. That's so true. So we only got a few minutes left because I don't want to take up people's time, because we just talked about people being very busy. If there's, I guess, anything else that people want to share, if you want to get it to us and we can get it out to any other people, if it's something that needs to go out to everyone in attendance or people in particular, we can definitely help facilitate that. But I do appreciate everyone for joining us and for all of the feedback. And I hope that other people recognize as well the benefit of actually having these type of conversations. And I think the more conversations we can have like this among providers, as well as even among the team members, like, you know, talking to the individuals who are actually going to be engaging with the families and making sure that they truly understand to what extent the MAP teams can be beneficial in their area, I think it's going to be helpful in helping us to grow the MAP teams, as well as getting those children who fit this category, which we understand is our primary focus, children at risk of being placed out of the home and children that are returning to the home. We want to make sure that families understand and that individuals that are supporting families understand how to support families in working through this process.